Today, I want to introduce you to no stranger here at Parental Guidance, Dr. Brian Grotkow. Welcome. We're so glad to have you back.
Thank you.
So Dr. Brian Grotkow is UHealth Jackson Children's Care Chief of Pediatric Orthopedics and Surgical Services at Holtz Children. He's also the Professor of Orthopedics and Shriner's Children's Endowed Chair in the Pediatric Orthopedics at the University of Miami Miller School of Medicine. He is an accomplished board-certified orthopedic surgeon, as well as a researcher specializing in pediatric orthopedic and adult spine disorders. So there's a previous episode that we have all about spine surgeries, and man, it was fascinating. So you can go back to the archives and listen to that one. But today we're going to kind of hone in on children and athletics. He did an orthopedic residency and fellowships in spine surgery and pediatric orthopedics at Massachusetts General Hospital and the Harvard Medical School in Boston. Dr. Grotkow's clinical interests span a wide range, including scoliosis, anterior vertebral tethering, which we did a whole episode on that. So cool. I learned so much. And vertebral body tethering, as well as pediatric spine surgery, pediatric orthopedics, congenital and acquired disorders of the musculoskeletal system, cerebral palsy, that's the episode that we did, clubfoot, hip, knee, and leg disorders. Man, he really covers it all, as well as neuromuscular disorders and pediatric trauma and fractures. So if there ever were an expert on this topic, he is here. And not only is he here, but he's brought an expert with him as well. So please introduce Dr. Grotkow, your special guest.
I will. After that, I don't know if we have any more time. We're going to have to sign
right?
off.
There's a lot. You've done a lot.
No, this is Dr. DiVirgilio. Dr. DiVirgilio just joined us literally this week, this Monday,
Awesome.
from Harvard as well. He was up at Boston Children's Hospital until last month, and then moved down here. And he's actually his entire practice is pediatric sports medicine and pediatric young adult sports medicine. So I said, hey, listen, let's put your face out there. Let's get your expertise on this as well. And just wanted to introduce him, and we'll field the questions you ask us together.
I
today,
love
if that's
it.
okay.
Well, we are in such a unique opportunity today. We're so glad to have you, Dr. DiVirgilio. Thank you and welcome. We're happy to have you. Okay, I have so many questions for you. I do want to let our audience know, if you have a question for our experts, put it in the Q&A feature. We're going to do it a little different today. We're going to wait till the end because we've got so much to cover, and we'll do all of our audience questions at the end. But as you think of something as we're discussing, drop it in that Q&A feature, and so we can be sure to get it in front of our doctors here. So let's start at the very beginning. Tell us why parents should be concerned about sports injuries in young athletes.
Thanks. The reason to be concerned is that, based on the latest data, which I would say is the mid like let's say 2017 or something data, about 3.5 million kids under 14 present to emergency rooms every year for sports injuries.
Wow.
And these injuries can sideline them for what they really love to do. And if severe, they can cause long-term problems that, and our job as parents really is to, the kids all have the short sight, like the next 2 weeks. Our job as parents is to get them to our age and beyond. And that's why we should be concerned about this.
That's right. Oh, that's so great. I love that that point right there really applies to all of parenting, is we're helping them see the long game because they can't see that long game yet. So I love it. Are kids more vulnerable to injuries than adults?
You want to do it?
Yeah, I think that's a fair thing to say. Kids are still growing, and they still have open growth plates, which is actually an area of the bone which is weaker than the bone. And as they are growing as well, their muscles and tendons are also trying to keep up, and they stretch out a little bit. And that puts them at a higher risk of getting injured than adults.
Yeah. That's great. Thank you. I will say, if y'all will just scoot close to that camera so we can be sure that we're hearing you real good there. But yeah, you're talking about the growth plates and how that part, I didn't realize, is part of that bone, but obviously it's more susceptible to injury there. So
they're weaker than the surrounding bone. It's weaker than the surrounding bone. Yeah.
Okay. Makes sense. What types of injuries are most common in young athletes? Are there certain ones to be aware of?
Well, when we think of injuries in kids with growing skeletons and stuff, but even older kids who've already closed their growth plates, there's really two types we think of. We think of overuse injuries from basically doing too much repetitive stuff, and acute injuries, right? So overuse, it usually results from repetitive things like repetitive pitching, repetitive running, repetitive jumping, things like that. Acute injuries are like, a fall with a wrist injury, you get tackled and there's some sort of injury, or you run into another player like like playing hockey or something like that and get slammed into the boards or have a collision with another player. That's how we divide the kids' injuries.
Okay, the overuse and acute. Now, I understand obviously the definitions of one, but I got a little baseball player. My husband coaches baseball. We know that the high schoolers have a pitch count because they're trying to avoid this overuse. So exactly what is happening in an overuse injury?
So an overuse injury is a result of sort of repetitively doing the same thing over and over again. Now, adults, anyone who's been a clerical person or a contractor or something knows about things like carpal tunnel syndrome, which is kind of an overuse thing, right? Well, the same thing can happen in kids, but of course, kids aren't, well, they are typing, but they don't seem to get it from that. But what they get it from, like repetitive throwing, repetitive jumping. And so they get these little injuries that, and then they don't take enough time to rest and get better from each little injury. And then they become a cumulative problem over time. And it basically is a result of too much, too soon, too often, right?
Okay.
Too much of the activity. You get back to the play too soon, and you're just doing this too often. And then that's what the repetitive overuse injuries are generally from.
Okay. What about, we see this a lot these days, like my son's going to be MLB player, so he plays baseball when he's 3, So let's talk about how big of a problem is early sport specialization.
Yeah, so early specialization is something that we've been hearing more and more, especially in the pediatric sports world. And what it means is basically when a kid plays a single sport for at least 9 months or more of the year. And the thing with this is that we're not giving kids enough time to rest. And since this happened, it increases the risk of then having injuries and also increases the risk of burnout as well. And they may start losing interest in the sport and they may not enjoy the sport as much. And an interesting fact I have about, since you mentioned pitchers, is that there's been a recent study that showed that actually most of the pitchers in the MLB didn't actually start pitching until high school.
Oh, wow. That's cool.
So I think that's a very important thing for parents to know, because sometimes they really push kids to start pitching as soon as possible, but that puts them at an increased risk of injury. So knowing that also helps.
Yeah, so it
can
actually
throw out all those pitches too soon.
Right. It's actually, as he's saying, it actually can be counterproductive. If you're a parent who says, and then we get a lot of these, this is the one, this is the one that's going to make it. They're going to make it to the majors and everything like that. And you sort of just do too much with sports specialization early. They lose the ability to be the one, either through injury or they burn out. I mean, kids burn out of sports. I've seen some kids that are just phenomenal athletes at their game be pushed and pushed and pushed. You got to engage the kid in the child and how much they want to be involved, or let them explore other opportunities, other sports and things like that. And because I think that's what leads to longevity. It's not just injury; it's sometimes psychological burnout.
That's good. I'm so glad you mentioned that, because we do kind of just think physical injury. And to your point, my husband coaches baseball and he's got kids that they're not coming to try out because they're like, I don't want to do baseball. And he's like, you're in 8th grade. And he's like, I played since I was 3. I'm burnt out. And you think, wow, like, are we doing our kids a disservice, So that's great. I love that you spoke to that too. It's not just physical, but the mental burnout as well. All right, let's talk about, is it true too much training is harmful? We're spoken to the burnout, but what about also just the training and the...
Yeah, I mean, just in keeping with what we've already talked about, is that you can train too much, both for burnout purposes and injury purposes. And then, so the rule of thumb, I think, that is bantered about, I don't think there's a lot of scientific evidence to suggest it, but a lot of things we do don't have great scientific evidence behind it. But a rule of thumb is kids probably shouldn't train more hours per week than their age in years. Okay.
Oh,
and they need a couple of days off a week so their body can recover, so that they don't get the repetitive use injury. And they really need at least 2 to 3 months a year off of, their sport in order to, allow their body's growing, right? And if you're
Right.
constantly insulting the body with the same sort of activities and everything,
Yeah.
then it's going to be harmful for them in the long run. And so that's basically what we say is, no training than more hours of training a week
Then
than
you're
their years, 1 to 2 days off a week, 2 to 3 months off a year.
That's good.
And
Oh, that's good. I
to
feel like
add
we need
something
that
to
on like
that,
a printable.
yeah,
That's
yeah, yeah, for sure. That's a good rule of thumb. Also, and it for those extra 2 or 3 months that they're not doing their sport, it doesn't mean that they're not doing anything. You know,
right.
if they let's say they are a pitcher or they play baseball. If they play baseball for 9 months, then the next 3 months they can do something else. They can do soccer, they can do basketball. That's what we call cross training.
Oh, right.
So it's a good way of keeping them doing something all year, but not necessarily having them doing the same thing
Mm-hmm.
that could lead potentially to injuries or burnout.
That's good.
Because let's be honest, sports has a lot of good things. So if you can keep them involved the whole year, the social aspect is very important, right? They're gonna
Yeah.
go out and play with their friends. So, but as long as they are mixing and matching,
That's good. It's like you don't go to the gym and do leg day every day. Like you got to diversify, right?
exactly. Yeah,
Bingo.
you
That's
got it.
Cross
exactly
train.
true. Yeah.
Okay, what about we know how important sleep is for our children's development, all that. As moms, we're always chasing sleep. So, what about how does sleep play into injury prevention?
It's very interesting you asked that because I think it's a pretty insightful question because, there's data out there that show that teens who get less than 8 hours of sleep per night have double the risk of sports injuries. So
Wow.
sleep allows the
Wow.
body to recover,
Yeah.
right? And I think it's an underappreciated thing. So
Right.
sleep, by insisting on more sleep, believe it or not, you lower the risk of injury or lower the rate of injury, I should say.
Wow.
Yeah.
Wow. I mean, say that statistic one more time because that's staggering. You say 8 hours,
So
less than 8 hours, double
yeah, and
the
it's true of
odds.
teens. I mean, it hasn't been looked at in little kids,
Right.
but if you get fewer than 8 hours of sleep per night, you almost double the risk of your injury from sports.
Wow.
Yeah.
Wow.
And it's probably multifactorial. I don't think anyone knows why, but there
Right.
could be a bunch of reasons. Your
Oh,
reaction
yeah,
time is lower,
for
you're
sure.
fatiguing earlier and everything like that. But it's still, as we say, facts are stubborn things. So,
Yeah.
your child's not going to necessarily be the exception. I think that
Right.
it's a good thing to keep in the back of your mind when you're, sort of helping plan out what they're going to be doing.
That's good. Facts are stubborn things. I'm taking that away.
Oh,
That was
sorry.
good. No, that's good. That's the reminder. Like we have this scientific evidence. It's great. All right,
Yeah.
let's talk about lifting weights for kids. Should parents encourage weight training for young athletes? When is that relevant?
I think weight training is excellent
Awesome.
for
Okay.
kids. Yeah. The important thing here is that they have to focus on the technique rather than wanting to lift the heavier weights possible. So very important to look at the technique, have someone help them through that, either athletic trainer or physical therapist. But it's very important. It helps them get stronger muscles.
Mm-hmm.
It helps them with balance and coordination, more better control of their limbs overall,
Mm-hmm.
and decreases the risk of injury. So very important for them to start weight training whenever they feel like.
I
Safely.
couldn't agree more.
Yeah.
So the tendency for kids, especially teenagers, they want big muscles, they want
Oh, yeah.
impressive muscles, they want to be strong and everything. But it's true that lean muscle mass is what helps you in sports, right? Not
Okay.
bulky
Yeah.
muscles. And you
Right.
get lean muscle mass by low weight, higher rep. So
Uh-huh.
focusing on technique is super important to avoid injury, but also you want to do weight training that you don't want to your classic weight training is trying to do this bench press
Bench press.
for 3 times,
200, whatever.
Max out.
Yeah.
yeah, you want something you can do 10 times, right?
Yeah.
And when you
Right.
can't, when you get up and can do it 20 times, maybe that's the time to increase the weight or something
Right.
like that. No, but working as Dr. Givillo says, working with a trainer, if the child is really serious about sports and it's not cost prohibitive, working with the trainer to help plan a thing is probably a pretty smart idea.
Okay. Is there a certain age? Is there a hard, fast rule on that? Or is it more just when kids are safely, I'm thinking I'm doing lifting my little dumbbells. Like my 6-year-old can lift a 2 pound just with me to learn how to do things safely, right? Or what is
So
it,
there used to be a dogma that said, if you're below 13, you shouldn't be, lifting weights. I think that's been shown to not be correct. But the whole thing is everything in moderation, right?
right,
If your 6-year-old wants to do, 1 pound curls or something like
right.
that, who are we to say no? It's just everything in moderation, right?
That's right. That's right.
And not with, he shouldn't be a what do they call him? A gym rat
Yeah,
at
right.
6 years of age.
Maybe later.
That's right. Oh,
you
that's
know,
great. No, I love that. It's eye-opening and a reminder that, sometimes we look for a hard, fast rule on certain things like that. But what you're saying again, just so important, the technique and the safety more than they need you to be bench pressing heavy weights and using heavy weights. So they need to learn how to do it safely. That's great. What about, are there any proven like warm-ups, like programs to do that can help reduce injury?
Yeah, oh, yeah, there are documented ones. And so this first came out because there was a realization that ACL tears were
Uh-huh.
considerably more common in female athletes and young
Oh,
female
wow.
adolescent athletes than in male athletes. And so a number of these programs sprung up that actually were data driven that diminished the likelihood of ACL tears. And so the one that when I was up in Boston, the one we had there was called CATS, and I don't know what it stands for. I don't remember, but it was an ACL injury prevention. I think they've expanded a fair amount, and so there's one called Fight 11 Plus, and then PED warm ups. They've been shown to cut knee and ankle injuries by about 30 to 50%. So
Wow.
the programs all share a commonality of increasing balance, core strength, and proper landing drills for various
Okay.
sports, right? Because it's often on how you land. You're kicking a soccer ball, how you land when the injury comes in. Basketball, certainly, and things like that.
Yeah.
Do you have
That's great.
anything add on that?
No,
Or?
that's pretty much it.
Okay. Yeah. So there are, and the availability varies by region, what you have in your area, but there
Right.
are some, and they have been documented to decrease injuries and injury
And
rates.
obviously stretching is so important, right? I mean, I just think you don't jump into a football practice or whatever without some stretching. I think that isn't that important, imperative for.
Flexibility is very important. Now, so there's a debate of whether you stretch before or after activities. I think
Okay.
that I say why not do both. But I think the data suggests that stretching afterwards is more important than stretching before. The last I saw, I'm not going
Okay.
to pretend I
Interesting. Cool.
yeah, I follow that. But my thought, whenever I tell people, I said stretch for 10 minutes before, stretch for 15 minutes after,
Yeah.
because I do think that's a neglected part of things. And I used to think about this. It's not like I sit around and think about stretching all the time, but I had a number of years when I was trying to figure out why the coaches and teams don't do that. And I came to the realization is that play surface time is so hard to get.
Oh, wow.
Time on a soccer field, time on a football field, that
Interesting.
coaches don't want to waste that or squander that time with stretching. They want to do drills and the things that you absolutely need that for. But I think that you keep kids in the game a lot longer if you do the flexibility stuff like you're talking
Yeah.
about.
That's great. I feel like I'm at the age where the stretch is the workout. I'm like, oh
Yeah,
goodness.
I know. That's
Um,
what I said. I said, at what point did walking become
yeah,
exercise?
that's right.
That's where I am.
Exactly. All right, let's talk about what role coaching can play in injury prevention.
I think coaching plays a huge role, right? They're right there with the kids most of the time. They can give a lot of tips on again technique, proper techniques, like Dr. Raka was mentioning, proper landing mechanisms. They're the first ones that are going to hear if the kids have any pain, any soreness, and if they know that they shouldn't push the kids too much. They're the first ones that are going to be there to say, okay, you probably need a little bit of rest, and they're going to talk and communicate with parents as well. So they play a huge role in this in kids sports and
Yeah.
injury prevention as well.
They also have a potential. I mean, it's really important on the good side, but they can also, sort of send subtle clues that, that aren't good, right? And
Yeah.
most of us, well, probably most of the people watching aren't quite my age, but Bella Carosa, there's a famous image of him, holding one of his gymnasts, who was hurt, and then the whole concept of even if doing it for the team, even if you're injured, came out, and
Right.
that was a real hard thing to overcome after multiple, it lasted a number of years. So I think the coach can reinforce what the parents are doing, or, and I think the coach has to have the same outlook as the parents that,
Right.
it's great to win this game. It's great to go to the championship, but these kids are my responsibility, and it's my responsibility to get them to adulthood healthy.
That's right. Have that long view. Oh, that's
Right.
good.
Have the long
Something
view,
maybe you're
right?
not parents ought to be thinking as we're, signing up to be part of certain
Yeah.
teams and leagues. I
Right.
think that's great. That's helpful. All right, let's talk about equipment. Does equipment really make a difference at all?
Yeah. Yeah. I mean, there've been, like, let's talk about football for a second. Properly fitted helmets and shoulder pads and everything. Those, the helmets are interesting because it seems like almost every year, a twist on the helmet comes out,
Mhm.
in pro ball. So
Right.
pro football has been great for youth football, right? Because a lot of the safety stuff filters down very quickly to the kids' sports. My son used to, when he was in college, he was designing football safety equipment for a company. He was a
Cool.
mechanical engineer down in Houston.
Wow.
And
That's cool.
yeah, and it really opened my mind to how much research and technology is going into trying
Goes
to
into
make
it.
the
Wow.
equipment better. So, supportive footwear is important. Appropriate protective gear we know can lower the risk of injury,
Mhm.
especially severe injuries. The other thing that I think is underappreciated is safe playing surfaces, right? Not every
Yeah.
kid has access to a turf field for their
Right.
soccer games, for their football games, where it's not going to be rutted and everything. So kids are
Mhm.
playing, which, I mean, it's nice. It's on grass fields, but a lot of the grass fields, because of budgetary constraints and stuff, aren't really maintained all that well. And so when my kids were playing soccer, we had grass fields, and the parents. So I got the parents together, and we would go walk the field, and
Oh, that's
I would
great.
bring a garbage can full of dirt, right? And we'd walk the field, and we found a rut, because a lot of kids will injure their ankles, get an ACL tear on a rut. We would fill it in. It wasn't our field. No one ever yelled at us, but I
That's
think
right.
it made
I love it.
the surface much safer for the kids and diminished the risk of injury. So I think parents should play a role in the safety of things too, not just
Great.
not just the other aspect of things. And I think that if you have a situation like that, that's what you want to do.
Oh, that's great. All right, we've talked about equipment, coaching, sleep. Let's talk about nutrition and how
Yeah.
does nutrition affect injury risk?
He's a lot healthier eater than I am. So go
I love it. Give it to us.
ahead.
Nutrition is super important. Obviously, kids are growing up. Now, this is the fuel that they're putting in the body for them to successfully keep growing and stay injury free, right? So super important to maintain good nutrition, especially I would say female athletes who have started having their periods. There
Hmm.
is a lot of evidence showing that not having the right caloric intake, so not having appropriate nutrition, can lead to hormonal imbalances
Oh,
that
wow.
can also lead to problems in the bones, weaker bones.
Oh,
That can
wow.
lead to stress injuries. So again, very, very important that nutrition aspect. I don't know if you have anything else to.
Oh, that's
No,
great.
I just think it's again, it's an underappreciated
Yeah.
side of things.
Yeah. Yeah.
If you have someone who is calorie restricting, right, then they're probably going to have weaker bones and stuff like that as
Yeah.
well, and more prone towards stress fractures and such. Which are stress fractures are different because it's a repetitive overuse injury where the bone eventually fails because the bone architecture um, isn't quite strong enough to to meet
Like
the
bear the
repetitive
weight or
demands
yeah.
put on it.
Okay.
Yeah,
Right.
yeah. So I think nutrition is very, very important.
Oh, that's
Yeah.
awesome. When you said that about girls, I immediately thought of, I'm thinking even like dance. We talk about sports, but thinking like dancers. And like I've had friends who danced and they had stress fractures on their feet and didn't even realize, but thinking how important all these aspects play into that. Wow. Yeah. Listening to this, if you're listening, maybe as a guest, you're thinking, okay, sleep, okay, nutrition. What's encouraging is that we have we could do a whole episode just on nutrition and sleep, and we have. So you can check out the archives if you're going, okay, nutrition, sleep, these are things I can be doing to help my young athlete prevent. Go look in those archives because we have multiple episodes on nutrition, definitely one on sleep. So kind of these topics within this bigger topic, how it all works together. So on top of nutrition, hydration. Obviously we're sending kids with water bottles to practice, but how important is hydration?
Oh, it's critical. Every couple of years we hear on the news some terrible story where it's usually a kid because it's a late summer sport, football and
Hmm.
such, who gets heat exhaustion or heat stroke because they didn't they were at football practice, and I'm sure it's not just for football practice, but and they didn't stay hydrated enough. So I think it's really important. Dehydration reduces performance. So I always like to think not only is it bad for your kid, but okay, so give the kids some tangible stuff. So it decreases your performance if you don't stay hydrated.
Yeah.
Delays reaction time. So if you really want to be at the top of your game, you want high performance, good reaction time. And then you don't want cramping and heat illnesses, heat stroke
That's
or
right.
heat exhaustion and stuff like that. So I think it's super important that the kids drink before, keep hydrated before, during, and after games. Water is great. The Gatorades or Powerades are a good idea because they do work with the or help replace the electrolytes and stuff like that. And I think it's also important. Again, the parent's job doesn't end when they drop the kid off for the practice. And I think it's important that that the parents speak with the coach to make sure that they share the philosophy, right? Is that we have to take frequent breaks to hydrate and stuff like that, because maybe even setting a timer for every 45 minutes or something. We need to
That's
have a
good.
5-minute break so everyone can get hydrated and such. Because I think it's critically important, especially here in South Florida. My gosh, it's
Yeah.
never
Yeah.
not hot,
Always
right?
summer, endless summer,
Yeah, yeah, it is
endless
endless
hydration.
summer is exactly
I
right.
love what you said though about not just talking about it's bad if you don't, but the good things that it's helping you with, helping our kids understand. This can make you stronger and faster and more focused. So focusing on the positives too of what they should be doing, why they should be doing these things. All right, what about, we talked a little bit about overtraining, overuse, those kind of things. Are there warning signs that parents should look for that a child might be overtraining?
Yeah, I'm kind of the expert on undertraining here,
Love it.
but why don't you try overtraining, my friend?
That's
Some of
great.
the signs, yeah, definitely there are signs. The first one, and I think I mentioned it before, is loss of interest. They start
Okay, can you
burning
speak
out
a
a
little
little.
bit louder?
Yeah,
Sorry,
yeah,
just so
yeah.
we can hear
I
you.
think I'm a little far away.
Thank you. No, that's
I
great.
got a louder voice. I'm going to
I
scoot back.
love
I'm going to
it.
scoot closer.
Thank you.
Can you hear me fine there?
Yes, better. Yes.
I think I mentioned it earlier, loss of interest is probably one of the bigger ones that we see. Um, and that ties with what Dr. Greco was mentioning with burnout as well and the
Yeah.
psychological aspect. So
Yeah.
that's one of the signs. Another one could be fatigue, persistent pain, that they're complaining of pain. And what I would say about that is that if they're complaining of pain, uh, parents really shouldn't try to push through the pain,
That was my next
Sometimes,
question. Like, do we push
yeah,
them through? Yeah, we kind of think we can
yeah,
a
and
little bit, but
yes. So if we go into that, I don't think you should, because it's kind of the body telling you that you need to stop and have some rest. It's kind of
yeah.
your body telling you that maybe you reached your limit for the day. You need
Yeah.
to take some rest and come back tomorrow. So yeah, in terms of pushing through pain, I think it's not recommendable. It's nice if that happens to take a couple of days of rest, and that, I think it's the safer way to go and think about it and kind of like reduce the risk of injury.
Yeah. Well, tell me that what you said again, Dr. Crockel, the as only train as many years as you are old, like that many hours a week,
Uh,
and then you
yeah.
said taking days off and months off. Say that again. I think that's
So
helpful here.
yeah, so you want 1 to 2 days off a week. Yeah, I mean, it depends on the age of the kid and
Right.
child. And again, I'm talking about a single sport here, right? So
Right.
I think that, as Dr. DiVirgilio said, that if someone's doing swimming and football, I mean, those are pretty different, right?
Yeah.
And it for some reason, the psyche of different sports is different, right? So you could potentially, be 5 days in football and 2 days of swimming on the weekend or something like that. But I'm not saying that you should do that. But when you're talking about a single sport, you want 1 to 2 days off a week because it's easier on your body, it's easier on your mind. And then you want I was a swimmer when I was growing up, throughout, and we always took at least a month off a year. I mean, I think the new suggestions are a couple of months, 2 to 3 even, off of that single sport a year. And we see this a lot up in New England where hockey is a year round, and I think it's getting that way down here in South Florida. It's that kids are in 3 to 4 hocky leagues, and you really have to give it a rest at some point, so the kids can sort of regroup and not get injured.
That's right. Well, to your point, I just feel like there's even a larger conversation going on, but there's the travel sports now. It's like, it's not just the season. It's like you can also travel and do the off season. Then you're just, when did they take a break? So I love just hearing from two experts that this is a way to take care of our kids and their bodies. I have a few more questions for you. So audience, there's things that you're thinking of, drop those in the Q&A and then we'll get to your specific questions. But, on that note, pressure of competition with keeping their kids safe. We have to have that long end view, like you're saying. So how can parents balance that?
I guess, parents have to be the parent in the room, right? I mean, not to overstate the obvious. I think you want to focus on fun, skill development and long-term health over short-term wins, right? I touched on that a little bit before, when we were talking about coaching, but it's also true of parents, what you're really looking at is you have to look at the long term here, right? And I think you have to remind the kids, it's your job to remind the kids, and frankly, the coaches as well, as we talked about, that rest and safety are a huge part of being an athlete, right? If you look at, we used to cover some professional teams. I didn't really, but I did take care of, sometimes. And built into all these professional teams is periods of rest, right? It's, flexibility stuff that we were talking about. Safety is huge, right? And the managers of these professional athletes are really black and white on safety. Feel something is not safe for their client, they aren't gonna, intervene and stuff like that. I think, the parent is the kid's agent. And I think you have to be their agent. You have to be the interface with the coach because a 13-year-old child is not going to say, "Coach, no, I'm not going to do that." Right. That's right. We can't just be intervening because we want more playtime for our kid on the soccer field or more playtime in the football field or something like that. We have to be, intervening for safety, for perspective, and skill development. You want your kid. The idea behind being a child athlete is number one, have fun. Yeah. Number two is to develop skills, that you can use later on. Yeah. And so I think
be on a team. Yeah.
Exactly. And all the social stuff, social good things that go with, including competition. Competition is a good thing.
Good thing. Yeah.
Right. And so that's where I think that that's how you balance it, I think.
Yeah. That's great. All right, what about the role as doctors? So what role do doctors or athletic trainers play in prevention of injury?
I think the biggest role that we play is being advocates for patients' health.
Yeah.
And kids' health. I think we always it's our role to put the kids' health in a first plane,
Yeah.
The other thing that we are actually involved with is kind of pre-season physicals will help a lot with that. We also, with those, we make sure that the kids are safe to play through the season. And at the same time, we also do some other stuff like sideline coverage and being there for kids while they're playing and maybe they get an injury, where they're always trying to take care of them. And also, if they get injured, we try to make a good plan along with the physical therapists and trainers for them to recover and for them to get back to what they love to do, which is playing sports in a safely manner.
That's great. That's awesome. I have one more question for you that I'm going to hold it to the end because I think it'll help us kind of tie a bow on our time. I want to take a few audience questions here. All right. Now, one parent, you spoke of the drills. There was like, I think you said the CAT system, but is there someone she said that they can find warm up and landing drills?
Can you repeat that? Sorry.
Yeah, if there was just anywhere online or something that you recommend, I guess, for finding the warm up and landing drills.
Yeah, actually, it's called FIFA 11 Plus. If you type that on Google, it'll come up. There's actually two things that you're gonna find. One is the whole manual, which is like 40 pages long. It gives you the whole warm-ups. And there's like a single page one, which is an abbreviation, and it puts kind of like the
executive summary almost.
And that's the one that I have in clinic, and I actually give to all my patients as a kind of like injury prevention. So if you go and put FIFA 11 plus, FIFA 11 plus, you'll find it, and it's amazing. It gives you really good warm-up stretches, warm-up exercises, stretches, landing kind of exercises. And I recommend that to anyone who has kids, and kind of a good tool for injury prevention.
Okay. Oh, that's great. Okay. FIFA 11 plus, you said on Google. That's helpful. All right. What about, this is a good question. Are some sports easier or less stressful on kids' bodies, on their growing bodies? Like are there sports you would say, this might be a better choice?
So, my thing with that is it probably, but ultimately, and this is what I say to the kids all the time, the parents all the time. I said, because you get this question, is there something it's more important to be involved and active.
Yeah.
And so you're not going to get a kid interested in a sport that they're not interested in.
Right.
So there may be some that are less prone to injury. In fact, if you look statistically at what the most, at least in America, what the sport is that has the highest rate of injury, it's actually basketball. Right?
Wow, interesting.
So they generally aren't as serious injuries, but there's a lot of them. You get a lot of fingers to the eyes, basketballs to the face, teeth knocked out, ankle injuries and stuff like that. So every sport has its pluses and minuses.
Right.
So the important thing, I think, is to get the sport that the child's interested in, and and then try to minimize the risk of injury within the confines of what the sport is.
What they're excited about. That's good.
Yeah.
I think it's a gut check for parents too. Like, is your kid playing football because you want your kid to play football, but they want to swim?
We gotta get honest with ourselves.
No, that's good. All right. What
You're
about
living your glory days?
Yeah, that's right. Okay, here's one about sugar consumption. Does a normal sugar consumption for a teen negatively affect their athletic performance or worsen their chance of injury? Oh, I guess
not that I'm aware of. I haven't really given that too much thought. Not that I'm aware of, but I will tell you that so someone I used to swim with all the time as an adult. We would train together. Is a woman named Kathy Cunningham, and she was a sports nutritionist. And the take-home message, which she would always tell me, is that eat from the earth. That's the best diet. Eat from the earth. And what it says is that's lots of fruits and vegetables, right? Certainly, whole grains and meats and proteins and stuff like that, but minimally processed is always the best. And you can have any kind of fad diet and everything, but where you're going to really, what you really need to do if you want to keep your lean muscle mass down is eat from the earth, and that's true for the kids as well.
That's good. Eat those real foods. Love it. All right, here's another mama. When my 11-year-old complains about soreness due to running cross country and playing soccer during the week, can I use lidocaine roller on the back and legs, and can I give him Motrin to relieve pain?
Yeah, you can do all of those things, but I think the best thing the kiddo needs is rest.
Yeah.
But because those are basically the same sports, right? So when we talk about sports, even though technically cross country is different from soccer, they're running sports, right?
That's right.
So, probably the best thing is to back off until the pain goes away so you don't cause injury. I mean, I don't know if you have any other thoughts.
Yeah, that's exactly what we're discussing now, the overuse injury. So if he's starting to complain a little bit about pain, I think the best recommendation would be for him to get some rest
That's great.
until that pain goes away. And then ramp back up slowly and progressively.
That's good. If your child is experiencing pain or, and maybe you've tried rest, you've tried other things, and then you're kind of curious, oh, maybe they have an injury. Do you start with a pediatrician and referral to, someone like you guys, a PT, or go straight to a PT? What do you suggest there?
I usually say the first point of contact probably is always best with the pediatrician.
Yeah.
They serve a very critical role. They may not be particular experts in musculoskeletal stuff, but what you really want is someone who's got a holistic picture of how your child is doing. Because sometimes sport injuries aren't actually just sport injuries, right? I saw a kid this morning who was having discomfort and everything, and then they were involved in sports. And after I took a peek at him, I think he's got a juvenile inflammatory arthritis, right? So, it'd be really, so the pediatrician being the first point of contact can sometimes put all this stuff together and say, well, maybe you don't need to see the orthopedic person. Maybe we need you to get over here and see a rheumatologist or something like that. Or maybe it is, hey, we'll get you to the orthopedic. It's not just designed as a means to keep you from getting other people seeing you. It's really a clearinghouse of information,
That's great. The big picture. Yeah. Seeing the whole big picture. That's great. Why it's so important to stay up to date on those pediatrician visits so that you have that big picture to see. Okay, here's another one. What is your take on checkups for cardiovascular health of teen athletes, and what tests should we ask our pediatricians to run annually?
So sports physicals. Let's talk about sports physicals.
Yeah. So right now it's not recommended to do anything like an EKG on a routine basis. But what it's very important is for them to see their primary care pediatrician, and if they have a history of cardiovascular issues in the family, sometimes they do run some special tests for those people who have a family history of cardiovascular issue. But it's not we're not recommending every patient to have any special test regarding a cardiovascular exam, unless they do have some family history.
Okay, that's helpful.
Does that make sense?
Yeah, definitely. I think that's a buzz kind of right now. So people are like, oh, should I be doing that with my teen athlete?
Yes.
That's great. Is there any way, this is another audience question, is there any way to tell growing pains from a sports injury, and how do you treat growing pains? Is that something you have any insight?
Oh, that's $1 million question. Okay, how do you treat growing pains? So growing pains are a little different. So typical growing pains occurs in kids between, let's say, 4 years of age and 10 years of age. They tend to occur at night, and they awaken the kids from sleep. I remember when my middle son had them, I thought there was someone in there stabbing him. He blood-curdling screams when he woke up in the middle of the night, right? And so there is, not everyone has that sort of presentation, but they also tend to be episodic, right? So you'll get them for 3 weeks, and then they'll disappear for a month and a half, and then they'll come back and things like that. So generally, the overuse injuries are kind of related to when they're doing the sport.
Okay.
Sometimes it's afterwards. I'll grant you that. But they tend to be a little more reproducible and a little more consistent. Over the longer term is what I would say.
Yeah, that's exactly true.
Yeah. Okay. Yeah. So I guess we got a good answer.
I love it. Check. This has been so insightful and so incredibly helpful. I think we even got all of our audience questions. That doesn't always happen. So I love that we got through all of them. If there's any last ones, pop them in there now. But I do want to just take a few moments to just say thank you again. Like, to have 2 for 1 today was such a blessing. So Dr. Grotkow, Dr. DiVirgilio, thank you for spending your time with us. We know that you are busy and committed into a lot of places. So it means a lot that you would spend your time with us here. I love it if you would just take a minute and tell us. We've covered a lot of different things today, and maybe parents are listening going, oh, okay, like what now? But what are the top 3 things that parents should remember today?
I think tell me if you disagree, but I think I think we should avoid early specialization of sports, right? Which means, what does early specialization mean? It means cross training, right? Doing different sports. It keeps you active longer. It's less likely to result in burnout and things like that. Variety in sports participation protects kids for the long term. And again, we're looking to have a long-term outlook for our kids. Prioritize rest, good nutrition, because I think that keeps you good for the long term. And any,
And what we were saying, discussing about the warm-ups, very important to prioritize the warm-ups before going into practice or a game. Make sure if you want to look up the FIFA 11 Plus that we discussed, that's a great way of making sure that you warm up the way you're supposed to do it, with some strengthening exercises, stretches, some landing exercises as well. I think those three are.
I think that's if you had to nail them down to three, I think those are the three big ones that I would probably try to
Love that.
impress upon parents.
I love that. And you focus so much too on what you said about parents being their child's advocate with the coach, the liaison between the coach and the team and all these things. So it's just such a reminder of what a great privilege we have as parents. And I just want to commend everyone for joining us today. You are taking the opportunity to learn and to develop our own skills so that we can parent our kids in the best ways that we know how. When we know better, we can do better and do more. So thank you again, doctors, for both of your time today. We're so grateful. I do want to let you know, everyone who's watching, maybe you're watching this going, I didn't get all of it, or I want to share it with someone. We will have this on the website. Give us about a week, but you will get an email, and it's parentalguidance.org, and you can screenshot this graphic we're going to put up here if you want to go a little deeper dive into some of these topics, as well as at the bottom there, parentalguidance.org is all the previous episodes.